Vitamin D, a fat-soluble vitamin, is essential for calcium absorption and maintaining bone health. Vitamin D plays a significant role in immune function, muscle function, and cell growth. Vitamin D deficiency can lead to various health problems, emphasizing the importance of maintaining adequate levels. Vitamin D, acquired from sunlight, diet, or supplements, initiates its activation process. The initial hydroxylation occurs in the liver, transforming vitamin D into 25-hydroxyvitamin D, 25-OHD. A second hydroxylation takes place in the kidneys, converting 25-OHD into the active form, 1,25-dihydroxyvitamin D, 1,25-OH2D, which regulates calcium and phosphate metabolism. Sunlight exposure is a primary source of vitamin D. Ultraviolet B, UVB. Rays from the sun penetrate the skin, initiating vitamin D synthesis. UVB rays convert 7-dehydrocholesterol to provitamin D3, which then becomes vitamin D3. Dietary sources of vitamin D include fatty fish, such as salmon, mackerel, and tuna, egg yolks, and fortified foods like milk, cereal, and orange juice also contribute to vitamin D intake. Obtaining sufficient vitamin D from food alone can be challenging. Limited sun exposure is a significant risk factor for vitamin D deficiency. Darker skin pigmentation, older age, and obesity can elevate the risk of vitamin D deficiency. Certain medical conditions, like Crohn's and celiac disease, impair vitamin D absorption, increasing deficiency risk. Vitamin D deficiency can manifest through subtle symptoms such as fatigue and bone pain. Muscle weakness and mood changes may also indicate a lack of sufficient vitamin D levels. Severe vitamin D deficiency can result in rickets in children and osteomalacia in adults, affecting bone structure. Vitamin D deficiency impairs calcium absorption, resulting in weakened bones. Chronic vitamin D deficiency increases the risk of fractures. Osteoporosis, characterized by decreased bone density, is linked to prolonged vitamin D deficiency. Vitamin D plays a critical role in immune function. Vitamin D helps regulate immune responses and protect against infections. Vitamin D deficiency is associated with increased susceptibility to respiratory infections and autoimmune diseases. Vitamin D plays a crucial role in maintaining muscle strength and overall function. Vitamin D deficiency can lead to muscle weakness, pain, and an increased risk of falls. Older adults are particularly vulnerable to the negative effects of vitamin D deficiency on muscle health. Research indicates a correlation between vitamin D deficiency and an elevated risk of cardiovascular diseases. Cardiovascular diseases potentially linked to vitamin D deficiency include hypertension, heart failure, and stroke. Further research is necessary to fully elucidate the relationship between vitamin D levels and cardiovascular health. Vitamin D deficiency is linked to mood disorders, including depression and seasonal affective disorder, SAD. Cognitive decline and increased dementia risk in older adults are also associated with low vitamin D levels. Maintaining adequate vitamin D levels may support mood, stability, and cognitive health. Vitamin D deficiency is diagnosed by measuring the level of 25-OHD in the blood. A 25-OHD level below 20 ng/ml generally indicates a vitamin D deficiency. The 25-OHD level between 20 and 39 ml is considered insufficient. Optimal vitamin D levels for most individuals range between 30 and 50 ng/ml. Maintaining vitamin D levels within the optimal range supports adequate calcium absorption. Sufficient vitamin D promotes bone health and supports immune function. Vitamin D supplementation is a common strategy to address vitamin D deficiency. Vitamin D3, cholecalciferol, is generally preferred over vitamin D2, ergocalciferol. In supplementation, vitamin D3 is more effective at raising blood levels of 25-OHD, a key indicator of vitamin D status. The recommended daily allowance, RDA, of vitamin D is 600 IU for adults under 70. For adults over 70, the recommended daily allowance of vitamin D is 800 IU. Higher doses of vitamin D may be necessary to correct a deficiency, but only under the guidance of a healthcare provider. Vitamin D supplements are available in multiple forms, including capsules and tablets. Liquid vitamin D supplements offer an alternative administration method. Gummy vitamin D supplements provide a palatable option, especially for children. To maximize vitamin D production, aim for 10-30 minutes of midday sun exposure multiple times per week. Optimal sun exposure involves exposing as much skin as possible without sunscreen. Be mindful of the risk of sunburn and skin cancer from excessive sun exposure. Increase intake of vitamin D-rich foods to support overall health. Fatty fish, such as salmon and tuna, are excellent natural sources of vitamin D. Carefully read food labels to identify fortified products containing added vitamin D. Fortified foods, including milk, cereal, and orange juice, offer a convenient method to increase vitamin D intake. Consumers should be aware of added sugars and other nutrients present in fortified food products. Fortification serves as a practical approach to supplement dietary intake of essential vitamins and minerals. Regular monitoring of vitamin D levels is crucial, especially for those at high risk of deficiency. Blood tests are the standard method for accurately measuring vitamin D levels. Adjustments to supplementation and lifestyle are necessary to maintain optimal vitamin D levels based on test results. Excessive vitamin D supplementation can result in toxicity. Vitamin D toxicity can cause hypercalcemia, characterized by elevated blood calcium levels. Symptoms of vitamin D toxicity include nausea, vomiting, weakness, and potential kidney damage. Vitamin D supplements can interact with certain medications. Medications such as corticosteroids, weight loss drugs, and some cholesterol-lowering drugs may interact with vitamin D. Consult a healthcare provider or pharmacist to ensure there are no potential interactions between vitamin D and other medications. Pregnant and breastfeeding women often require higher vitamin D intake. Infants are a population at high risk of vitamin D deficiency. Older adults may need more vitamin D due to reduced skin synthesis efficiency. Maintaining adequate vitamin D levels improves bone health, immune function, and muscle strength. Sufficient vitamin D contributes to overall well-being by supporting various physiological processes. Adequate vitamin D levels may reduce the risk of chronic diseases, including osteoporosis, cardiovascular disease, and certain cancers. Vitamin D deficiency is a widespread health concern that is frequently underestimated. Understanding the causes, symptoms, and management of vitamin D deficiency enables proactive health management. Consulting with a healthcare provider ensures personalized advice and monitoring for optimal vitamin D levels.